Hello guys, let's talk about cardiac murmurs. A murmur happens when there is a disturbance to the normal flow of blood within the heart. So however, how blood flows from the atrium to the ventricle, from the ventricle out of the heart through the outlet valves. Once there's any disturbance to that normal flow, then it produces a sound which we pick up using our stethoscope, and we call that a murmur. So murmurs generally are classified into two. We have the diastolic murmur and we have the systolic murmur. Okay, diastolic murmurs are those murmurs that happen when when blood is flowing into the heart. Okay, that's a diastolic murmur. When blood is flowing from the atrium, either the right atrium into the right ventricle, or from the left atrium into the left ventricle during that phase of the cardiac cycle. That's what we call diastolic murmur. Any murmur that happens during that phase, either at the beginning, during, or at the end of that phase. Systolic murmurs are murmurs that happen when blood is flowing out from the ventricle during that phase. That's generally what we call systolic murmurs. I wouldn't go into too much, nitty-gritty and nuances at this point. Let's proceed. Now, diastolic murmurs, if I sketch the heart, so if this is, let's assume this is the superior vena cava, and this is our right atrium, and this is the right ventricle, and if we create something there, let's say this is our let's say this is our pulmonary. So this is our right atrium, our right ventricle, our superior vena cava, and this is our pulmonary artery or the pulmonary trunk. Let's look at that. Yeah. A diastolic murmur would happen when there's a problem with these. There's a tricuspid valve here that separates the right atrium from the right ventricle. Yeah, and blood will normally flow in this direction. Now, it's very important we understand the direction in which the valve leaflets move. So the question is, if this is an atrium and this is a ventricle, does the valve open into the atrium, or does the valve leaflets open into the ventricle? It's very important that you understand the direction the leaflets open into, because that would help us understand things like valve prolapse when we get to talking about valve prolapse. If you understand the direction valves move into, it also help you understand how murmurs happen. So for blood to flow seamlessly from the atrium into the ventricles, the valve leaflets open into the ventricles. So you have that seamless flow of blood. If the valve leaflets were to open into the atrium, then obviously you will have some pooling of blood, by the side, and that can increase the risk of having blood clots, intracardiac thrombi, and so it's the leaflets will open into the ventricles when they open, and when they close, they will look like this. Okay, they will usually be this way. Now, looking at that, let's look at a few causes of a diastolic murmur. If there is a narrowing, or what we call stenosis, of this pulmonary valve, so whatever happens on this right part of the heart also can happen on the left part. So if you have tricuspid stenosis on the left part of the heart, you can have mitral or bicuspid valve, mitral valve stenosis. If you have tricuspid regurgitation on the right side, you can have mitral regurgitation on the left side. So what will cause a murmur during the phase where blood is moving from the right atrium to the right ventricle has to be a tricuspid stenosis. So a tricuspid stenosis, as well as a mitral stenosis, if it's happening on the left part of the heart, okay, will cause a diastolic murmur. Now, another thing that will cause a diastolic murmur would be, now we have valves opening. This is our pulmonary valve, yeah, that will take blood from the right ventricle into the pulmonary artery. That's the pulmonary valve, and the leaflets will open into the pulmonary artery. So you have that seamless flow of blood, that unresisted flow of blood from the right ventricle into the pulmonary artery. The leaflets will open into the artery. The leaflets will not open into the ventricle. So it's good to understand the direction in which the leaflets open. Yeah. Now, if at the end of systole is that phase where blood is going to flow from this right ventricle out. At the end of systole, this pulmonary valve here will close. If that pulmonary valve is leaky, or if it's on the left part of the heart, if the aortic valve is leaky, you have a regurgitation, you have a backflow of blood. Now, a pulmonary regurgitation, yeah? So pulmonary regurgitation, or if it's happening on the left part of the heart, an aortic regurgitation. You have a diastolic murmur. So because now that brings us to classifying diastolic murmurs into early diastolic murmurs, mid to late diastolic murmurs. That's the classification of diastolic murmurs. Now, the beginning of diastole is when this pulmonary or aortic valve, when they close at the end of systole, that marks the beginning of diastole. So if you have a pulmonary regurgitation or an aortic regurgitation where blood is going to leak backwards, you will have an early diastolic murmur. So if you come to diastolic murmur, we'll come to the diastolic murmur and we classify it into early, and then we have mid to late diastolic murmur, yeah? For the early diastolic murmur, we have the pulmonary regurgitation, PR, and the aortic regurgitation, AR. Those are the early diastolic murmurs. For the mid to late diastolic murmurs, that's where we have the other one. We have the tricuspid stenosis, TS, and we have the mitral stenosis, MS. Okay, that is the classification of diastolic murmurs. So we've understood how diastolic murmurs happen. Okay, and another thing to note about diastolic murmurs is they're usually softer. So when they're usually described as blowing in character. So blowing, you typically hear the word blowing being used to describe most diastolic murmurs because the blood flow is usually passive. Remember, in systole, there is that contraction of the ventricles. You have more turbulence if there's a murmur during this systole. In diastole, usually blood flow is more quiet. It's much quieter. So the murmurs are usually softer and they're usually classified or described as blowing murmurs, blowing character murmurs. We'll move to, I'm going to wipe all of this and then we'll go into talking about the systolic murmurs, or without wiping it actually. If I flip this board, now systolic. For my spelling, systolic murmurs. Okay, systolic murmurs will happen at that phase where the ventricles are contracting. The ventricles will contract with the aim of pumping blood out of the ventricles into either the pulmonary circulation to the lungs or into the aorta that will now distribute the blood to the other parts of the body, the brain, your limbs, your abdomen, your thorax. Yeah. Now, if we go back to that image, this time around, let's say left. Let's put our 4. Let's do something like this, yeah? And let's call this is just an illustration, you know what I mean? I'm not a wonderful artist. I'm just trying to. So let's call this our left atrium and right and left ventricle, yeah? Whatever applies on the left side also applies on the right side. So this time around, let's use the left atrium. We know there are 4 pulmonary veins that carry blood back into the left atrium, and then you have your left ventricle and you have your aorta. Yeah. So this is the aorta. This is the left ventricle. LV. Let's make that clear, and we're going to explain that. These are your pulmonary veins, the 4 of them. Now, we have the mitral valve. So the mitral valve, MV, yeah? The mitral valve, when it opens, remember, it's going to open, it will open into the ventricle. So you have that seamless flow of blood from the atrium into the aorta, into the ventricle, okay? And then here you have the aortic valve. The aortic valve will open into the aorta. Okay? So you have that seamless flow of blood from the ventricle into the aorta. So understanding again the direction in which the valve leaflets open. Do they open into the atrium or do they open into the ventricle? Do they open into the ventricle, the outlet valves, or do they open into the outlet vessels? Understanding that would also help us understand what we mean by valve prolapse. So when you hear things like mitral valve prolapse, you begin to understand where the leaflets are opening into or bulging into. So let's proceed. So we classified diastolic murmurs into early diastolic murmurs, and then we had mid to late diastolic murmurs. For systolic murmurs, we also have early systolic murmurs, which we commonly call the ejection systolic murmurs. We have late systolic murmurs. We have what we call pan-systolic, also called holosystolic. I'll explain. Now, looking at the heart, what do we think can cause a systolic murmur? When this left ventricle contracts, blood is supposed to move out into the outlet vessels, yeah, aorta or pulmonary artery. So if you have a narrowing of the aortic valve, so aortic valve stenosis, and on the other side, on the right side, pulmonary valve stenosis, okay, or narrowing, would give you a systolic murmur, and it's going to be an early systolic murmur. We'll get to that. What else can give you a systolic murmur when this ventricle contracts? If this mitral valve is incompetent, which means if blood flows back into the atrium, you have a murmur during systole. So mitral valve regurgitation or incompetence. Mitral valve regurgitation, and conversely on the other side, tricuspid valve. Is the camera going to show that? Yeah, tricuspid valve regurgitation. Okay, these will give you systolic murmurs. There's some other things that will give you systolic murmurs. Let me just write them down so I won't forget. A VSD, ventricular septal defect. So a ventricular septal defect will give you a systolic murmur. I'll explain how and why. An atrial septal defect will give you a systolic murmur. I'll explain why. An atrial septal defect will also give you a systolic murmur. I'll explain why. Let's start with classifying them. A coarctation of the aorta. I don't want to forget, I'll explain how each of them will give you. A coarctation of the aorta could give you a systolic murmur. Now let's talk about how these pathologies or problems will give us systolic murmurs and what type or what phase of systolic murmur will it be. Aortic valve stenosis, which means there's a narrowing, tightening of this aortic valve or pulmonary valve if it's on the right part of the heart. What will it cause? It's going to cause an early systolic murmur, also called an ejection systolic murmur or ejection systolic murmur, at the point where the blood is being ejected from the ventricle into the outlet vessels. So, ejection systolic murmurs would be aortic stenosis AS and pulmonary stenosis PS. Those are the ones that will cause ejection systolic murmurs. Yeah? Ejection systolic murmurs. We have holosystolic murmurs. Holosystolic murmurs are those murmurs that happen throughout, from the beginning, through the middle, up until the end of systole, as this valve is contracting. Mitral valve regurgitation. So if this valve is incompetent, from the moment this ventricle contracts, blood will start leaking into the atrium. So the holosystolic is also called pansystolic. Pansystolic murmurs will happen in mitral regurgitation, okay, and tricuspid regurgitation, left heart, right side of the heart. Holosystolic murmurs. Now, another thing that will give you a holosystolic murmur or a pansystolic murmur is a ventricular septal defect. So a VSD will also give you a holosystolic murmur, because remember this is the left ventricle, if the right ventricle is here, let's assume the right ventricle is here, so let's assume there's a VSD, there's a septal defect, let's assume there's an opening there, yeah, and blood is going to flow from the left ventricle into the right ventricle in a VSD. As soon as this left ventricle contracts, both ventricles will contract. Remember, the left ventricle has a higher pressure under normal circumstances. Blood will shunt, blood will move from the beginning of that contraction. From the moment both ventricles contract, blood will move, shunt from the left ventricle to the right ventricle, and that will shunt or movement of blood will happen throughout ventricular contraction, throughout systole. It will give you a VSD will give you. The VSD murmur is typically classified or described as a harsh murmur. As a harsh murmur. Okay, it's typically described as a harsh murmur. The murmurs from aortic stenosis, pulmonary stenosis are typically described as rumbling. Remember, when you have a systolic murmur, it usually creates more turbulence than a diastolic murmur. In diastole, blood flow is much quieter. It's more peaceful. It's slower, essentially. In ventricle in systole, blood flow is more forceful, so any disruption to that blood flow will generate more turbulence. So the blood flow, these murmurs are more rumbling, usually louder, rumbling, VSD harsh. These are subjective descriptions, yeah. Now, atrial septal defect. We say an ASD. So this is our right ventricle. Now, if I remove this just for illustration, let's take out that vessel there. Let's create our right atrium here, yeah. So if we create an ASD, yeah, under normal circumstances, initially there's something called Essemenga syndrome where you have a reversal of the direction of flow, in an ASD. But let's not get to an Essemenga complex or syndrome yet. So in a typical excuse me, in a typical ASD, blood will shunt from the left atrium into the right ventricle passively. Yeah, it just keeps shunting. And what's going to happen is that you have more blood eventually going from the right atrium to the right ventricle. You have more blood going out into your pulmonary artery. You have more blood being ejected into your pulmonary artery. So what's going to happen is that in an atrial septal defect, you have, or you could have, an ejection systolic murmur. Is it understood how that happens? Understanding what leads to what to produce an ejection systolic murmur in an ASD. I'll go over that again, just so it's very clear. In an ASD, blood will flow, will shunt. A shunt is an abnormal flow, yeah? Will shunt or flow from the left atrium into the right atrium. And that increased blood flow in the right atrium will transfer into the right ventricle. And that increased blood volume in the right ventricle will be ejected, will be pumped out into the pulmonary artery, the pulmonary trunk. That will create, so there's no problem, let's assume there's no problem with the pulmonary, with the tricuspid valve or the pulmonary valve, but that increased volume will create turbulence during ejection. It will give you an ejection systolic murmur in ASD. Bear with me. I've got a tickly cough. In coarctation of the aorta, becomes interesting. In coarctation of the aorta, remember, depending on the level of, so let's say there's a coarctation. Coarctation is just a narrowing, yeah? So this is the aorta. I've illustrated a coarctation there at that point where it is kinked or narrowed. Now what's going to happen is that during systole, the left ventricle has contracted, blood has entered the aorta. That blood will still eventually go through that coarcted or narrowed part of the aorta. So it can give you, a coarctation of the aorta can give you a late systolic murmur. Yeah? It may not, ejection systolic will happen here, depending on how distant that coarctation is. If the coarctation is close to the root of the aorta, where at the beginning of the aorta, you might have an early systolic murmur. If the coarctation is more distant, is farther away from the root of the aorta, the aortic valve, you have a late systolic murmur. Okay, a late systolic murmur. So a coarctation, COA, coarctation of the aorta, can give you a late systolic murmur. Just to mention Austin-Flint. Yeah? So if we go back to our diastolic murmur, we mentioned aortic regurgitation there, causing an early diastolic murmur. So this aortic regurgitation here, we're talking about a mild to moderate aortic regurgitation. If we have a severe aortic regurgitation, if the aortic regurgitation is severe, that means it's literally just porous. As soon as systole ends, blood just starts leaking from the aorta back into the left ventricle. So in a severe aortic regurgitation, if it's very severe, you can have a late diastolic murmur. The way I understand it, yeah, in a severe aortic regurgitation, imagine this, or a severe pulmonary regurgitation, yeah, blood will regurgitate, it will leak back from the outlet vessel back into the ventricle. But because it's severe, that leakage will continue, it will happen slower, and will happen over a longer period of time. That's why you can have a late diastolic murmur. You're going to have early in a severe aortic or pulmonary regurgitation. You would have early, more like a pan diastolic murmur. If you know, I've not seen that terminology being used anywhere, like a pan diastolic murmur, but you have like a pan diastolic murmur where you have blood beginning to leak early, and you know it continues to leak backwards or regurgitate from your pulmonary artery or your aorta back into the ventricle. That severe aortic regurgitation is called Austin-Flint. So if you see the term Austin-Flint, that's what it means, severe aortic regurgitation. Yeah, Austin-Flint. Graham-Steele is so this is Graham-Steele is, I think that's pulmonary regurgitation. I think that's the name here, Graham-Steele. But just so you know that this is how cardiac murmurs work. It's good to understand it. If you understand the way the valves function, especially understanding the direction. Yeah, I was going to miss something. Mitral valve prolapse. I'll explain mitral valve prolapse. Let me explain mitral valve prolapse. Let me wipe this. Remember, I was saying it's important to understand the direction of flow. I'll explain mitral valve prolapse very briefly, and I'll explain the kind of murmur you can have in mitral valve prolapse. Now, this is your left atrium, yeah? And that's your left ventricle, yeah? And that is your aorta. Here is your mitral valve. Okay, that's your mitral valve. Now, remember, normally the valves would open into the ventricles so that blood can flow in. Yeah, we've got that point. When the valves close, they don't close this way. When they close, they don't close this way. They don't close horizontally to touch each other. That's not how they close. They close in a way that there's a curve. That's why they're called cusps. They're called cusps. They close like cup. They're shaped like cups. Okay? So they close this way. Now what happens in a mitral valve prolapse? Remember, the word prolapse is like a hernia. What happens is that it kind of bulges, they bulge backwards into the atrium. And when that happens, when the ventricle is contracting, because of that prolapse, there can be some regurgitation. So in mitral valve prolapse, there could be regurgitation. The ventricle is contracting. The valve that should be closing at this point are being pushed into the chamber or the cavity of the atrium. That is the prolapse. That's what the prolapse means. And because of that strain on the valve, that change in the normal dynamic and mechanics of the valve, you can have a leak, a regurgitation. So a mitral valve prolapse can cause a diastolic murmur. Sorry, a systolic murmur. My bad. Because it's happening when the ventricle is contracting and this valve is prolapsing under pressure, and you can have a leak. So it can cause a systolic murmur. Usually, it's not an early systolic murmur. The valve will try to contain that pressure. Remember, the valve will not give in so easily. To try to contain that pressure, but under sustained prolapse and bulging, it will give way. But so there will be some leakage. So it will give you a late systolic murmur. So I should have actually explained it on the systolic side. A late systolic murmur is what you get in a mitral valve prolapse MVP. Most valuable player or most valuable personality. Yeah, in your MVP mitral valve prolapse, you could have a late systolic murmur. You mustn't always have a murmur in a mitral valve prolapse. There's a possibility of that prolapse, of that valve still holding forth. It prolapses, but it doesn't give way. If it prolapses and under pressure, ventricular pressure, it gives way slightly or significantly, and there's a leakage, eventual regurgitation, then you have that systolic murmur. So I just wanted us to understand things that happen in all of these pathologies and how they can actually create different forms of cardiac murmurs. I believe this video has been important, has been useful. It has been an avenue to elucidate and explain what cardiac murmurs are. Don't forget to like this video so the algorithm knows this video is important and suggests it obviously to other people. Subscribe to this channel. It's an educational channel where I bring useful stuffs to enlighten us, to teach us. So subscribe to my channel and share this video with people, medical students, doctors, nurses who really want to understand cardiac murmurs, the pathology, the pathophysiology of cardiac murmurs. Thank you, and I'll see you in the next one. Cheers.